so I'm very nervous today. Today my topic is about how to save your important people's lives. When I was in Japan, I worked as a nurse for 7.5 years, and most of the time I worked in intensive care unit. And I was instructor of CPR. Do you know CPR? And may I ask you a question? Have you experienced CPR? Did you have any training? Yes. If you experienced training about CPR, could you raise your hands? Oh. Okay, thank you. Thank you. First I want to explain about what is CPR. Sorry. CPR is to revive heart and lung by heart massage, mouth to mouth, and electric shock, etc. And next slide, please. Why CPR is so important? The main purpose of CPR is to keep enough blood circulation for our brain. If the heartbeat stops after 10 seconds, people lose consciousness. And after 2 minutes, 20% of people die. And 5 minutes, 50% of people die. And 9 minutes, 90% of people will die. And finally, if more than 10 minutes passes, it's almost hopeless to survive. That is why we need to do CPR. We need heart massage and rescue breathe. Next, I want to tell you about the flow of CPR for adults. It is only for adults. This guideline is from American Heart Association. American Heart Association, they renew guidelines every 5 years. So maybe before you learned, first we have to do mouth to mouth twice, and next we have to do heart massage 15 times or something like that. But they renew guidelines every 5 years. And today I want to tell you about the latest guideline. First, if someone collapsed in front of you, check the person's consciousness. Tap the person's shoulder and then talk to the person. If the person is unconscious, please call an ambulance and call other people to help. And then go back to the person and check if the person is breathing or not. If the person is not breathing, you don't have to do mouth to mouth. First, you have to do heart massage. This is new guideline. The core of heart massage is there are 3 important points. First, push hard. Second, push fast. Third, push continuously. This is very important. First, push hard. The depth should be at least more than 5 centimeters. If the depth is less than 5 centimeters, it's too shallow and it's not effective. Second, push fast. The speed should be at the rate of at least 100 times per minute. it is quite fast here. And lastly, push continuously. It is very important. Please don't stop until the ambience comes. And I want to talk about mouth to mouth again. Mouth to mouth is not necessary for adult, especially if the person collapses suddenly in front of you. There are 3 reasons. First, there is a risk of infection. And second, can you imagine if someone collapses in front of you, can you do mouth to mouth? Without any hesitation, can you do that? Maybe it's impossible if the person is very handsome or very pretty. Maybe that's possible, but for strangers, it's impossible. And while you are hesitating, that means we have to stop heart massage. That is why this rate will increase. That's why you shouldn't hesitate. And thirdly, enough oxygen remains in the person's body. That is why we don't have to be hurried. So from these 3 reasons, we don't have to do mouth to mouth anymore. But it's only for adults. If the guideline for kids and children are different. So it's only for adults. We don't have to do mouth to mouth anymore. And the bottom line is, if you find someone collapsed in front of you, first call an ambulance immediately. And second, start heart massage and push hard, fast, and continuously. That is the bottom line. And to conclude, I want to say that if you are interested in CPR, please try to attend the training course when you have time. Today I heard from nurse Donna here. In the Philippines, if we go to Red Cross Hospital or EMS Center, Emergency Medical Care Center, or if we go to fire station, we can learn CPR. And also, I think in Korea or of course in Japan, if we go to Red Hospital or fire station, we can learn CPR. And I want to say that among patients who were in cardiac arrest, 65% of people they collapsed at home, not outside. 60% of people they collapsed at home. That is why if you know how to do CPR, you can save your important people, like your family members or friends or co-workers. That is why if you have time, I want you to learn CPR.